So what are we going to talk about this evening? Well, there's a few things I want to talk about. I could be here all evening, but I'm going to spend the first hour with you, and then Dr. Marks, who's one of my partners at the practice, is going to come along and talk more about backs and spine and some of the things we're doing with that. But these are some of the things we're going to talk about this evening. We're going to talk about 3D printing, which is kind of new and exciting. Low radiation CT. There's been a lot of stuff in the press about CT scanning recently and how, of course, we know that it's a radiation-inducing modality, but the latest generation of CT scanners actually have very low levels of radiation. It's comparable to a chest X-ray or comparable to flying to, say, Sydney and back again. So it's not the high levels of radiation that we had, say, from 10 or 15 years ago. And we certainly have one of those CT scanners in our practice, and that's important to know. I'm going to talk briefly about some weight-bearing MRI. That's one of the things we do. We have some devices that we can actually load up the joints, so we get some nice pictures of, say, of knees in loading, and that's important. You see the meniscal extrusion and so forth. We're going to talk about RFD, PRP, orthokine, and we're also going to talk a little bit about stem cells, because the way I see it, that's clearly the way medicine is going. It's going towards these growth factors and cytokines and stem cells.